Hello, ladies and gentlemen. Today I'm going to talk to you about counseling. Counseling is part of psychology. Only the difference is with counseling, you are discussing and evaluating your patient's current situations and problems, and then you offer advice. Since they typically do not work with people struggling with very severe mental health, the patients usually consult the counselor to discuss the relationships. This may include substance abuse, problems in their career, and other problems. Such problems include making decisions about the career and work and dealing with school, work, retirement, relationship difficulties involving marital and family problems, stress management and coping with negative events, personal and social adjustment, and the development of one's identity. Um, I have to be very specific. There could be solving problems that require counseling. And some people have an inferiority complex, they may feel that they are less esteemed than fallible. Then their drinking habits, either drinking or alcoholism is very famous. There's drug addiction, and of course, finally, there's disturbed family life, mental worries. I, as a counselor, prefer using the psychoanalytic or psychodynamic theory. Um, Here, the technique is where I try to find out pre-unconscious forces that drive your behavior. I mean, when I talk to the client or the patient, I analyze his dreams to get important information about the unconscious. I also look for evidence of transference, that is trying to redirecting feelings about certain people onto your own, into one's own type. Maybe it could be childhood experiences which are relating to the current life. By bringing these issues to the surface, you can offer some treatment and healing by talking. Um, the other, that is the psychoanalytical. The other approach which I use is cognitive behavioral therapy. It is based on the ideas. What is cognition? Cognition is what um, you, your thoughts are, your feelings, and your behavior. And behavior is how your behavior is, and you try to change it. Basically, you've got your upset feelings, which leads to unhelpful behavior, and then they go back to negative thoughts. So it's like a cycle: upset feelings, unhelpful behavior, and negative thoughts. So here it is a cycle where the only way to break it is you have to. There are three self-help techniques. One is your peaceful mindfulness and meditation with a positive impacts. It helps people suffer from harmful automatic movements. Um, what can I say? Down here, you take the second step is you take little baby steps. Ask yourself the old question: how do you eat an elephant? And the answer is always once, one bite at a time. Whether you're working to overcome depression or break an unhealthy habit, change will won't be happening overnight. It takes time, maybe 3 to 4 months. The trick is to break the goal down into small steps. So you one step today, another step tomorrow, and a fourth step. And you map out the path to victory by setting yourself with little progressive wins and celebrate each achievement. You be proud of many positive changes, maybe one task a day, even a week. And the final thing is you try to refrain from negative thoughts. If you feel a little bit depressed or you feel negative, you should try to ignore them. Sometimes it happens because of the country you live in. This is called seasonal affective disorder. It may be more prolonged in autumn or in winter. This is called seasonal affective disorder. Try to rebalance your mind by a simple exercise. You write down 3 positive things in your life. and use this as a tool. Continuously use it on a daily basis. This is a very powerful tool in order to get over your negative thinking. I think that is all for today, ladies and gentlemen. If you have any questions, you can always subscribe to me on my channel. You can even confirm, send me an email. My address is rajeshwari32@gmail.com. And you can even check me on Google and you will find my phone number, which is 0789685034. Thank you, ladies and gentlemen.